There you are and welcome back. Let's now talk about activity-related risk factors. The force direction, it can be sagittal, it can be in compression, or can be compression plus sagittal force. And this is the worst case scenario. The direction of movement we can have, especially for the vertebral column, a flexion greater than 20 degrees or a torsion greater than 5 degrees per functional unit. A functional unit is the complex of two vertebrae and an intervertebral disc. And the combination of flexion and torsion place the vertebral column at much greater risk than flexion and torsion isolated. Time can also be a problem. Holding a static position for a prolonged time can change the viscoelasticity of the intervertebral disc, and this might expose some region of the intervertebral disc at a higher risk of developing a microtears. The high frequency of execution might expose the tendons and the ligament, especially to an elevated degree of use that might lead to tendonitis. A brisk movement, such as the one we sometimes try to perform in preventing a patient from falling back, might create a trauma to our musculoskeletal system, but we will see how to manage this in a separate video. Reaching extreme ROM with the shoulder or with the back might lead to the cease of the activity of the muscles, especially for the back. This is true if we go on flexion greater than 45 degrees, the posterior muscles cease to function, and thus the vertebral column is supported only by the passive elements, that is the ligaments and the shape of the joint. Strength. High intensity of contraction might lead to the tendon tissue. Intensity of contraction beyond load capacity, that is more similar to the previous factor that we just now reported. It's not exactly the same, but it's quite similar. And to win the inertial force of the object or of the patient, it requires an extra exertion of force rather than the force required to hold or to transport the object while in movement. And the last, position, asymmetry with respect to the median line, expose some structures of the musculoskeletal system to a higher degree of developing damage. Bye and see you next time.